Welcome back. It's not something to boast about when it comes to the opioid epidemic here in Florida. We're #1. But tonight, we separate the discussion from the problem involving illicit drugs like heroin and fentanyl sold on the street, and we look at the opioid pain medication being prescribed at what some people believe are alarming rates by physicians. And joining us for now are two pain management doctors with two very different points of view: Dr. Fabian Ramos of the Ramos Center, Dr. Lindsay Job of Restore Medical Partners, and Dr. Janet Taylor of Centerstone Behavioral Health. And thank you all for joining us tonight. And Dr. Ramos, obviously, we'll start with you because, and we discussed this in the office, the numbers, and we're dealing with Medicare and Medicaid patients, do show your practice third in the entire state for those years in terms of the number of prescriptions and refills written. But you say we should take into consideration volume and the dosages. Explain a little bit more.
Yeah, that data shows only paper count. It doesn't show prescription dosages or the amount of prescriptions written in each prescription. Also, there is a lot of data out there that shows the practice that I have, what I'm very proud of. I am all for having the latest technology, and opioids in my practice is the last resort. In fact, over 80% of the patients, by the way, the practice has over 10,000 patients, but 80% of the patients have interventional therapy, physical therapy, or mental health counseling only.
Let me ask you just a couple of really kind of key questions. I would imagine, I mean, are you personally writing those prescriptions that account for every one of those numbers, or is there other doctors, physician's assistants, and so forth?
We have 11 in my practice, 11 providers. We are almost 70% staff members. We have 4 nurse practitioners and 2 physician assistants. Here in the state of Florida, they cannot write prescriptions. So as they see the doctor that is managing, and we have 3 doctors, we just hired another doctor as well, they have to write for the patients that come. Now, I have 18 years in the community, which some of these patients are 15 years receiving medications extremely low dosages.
Right. Dr. Job, I want to talk to you for a moment because you said that when you moved to Florida, you were kind of horrified by whatever practice you were, you joined, by the ease and the numbers of prescriptions for opioids that were written.
That is true. I trained, I think, in a little bit of a different atmosphere than what I've experienced here in Florida. So the training, within the past 10 years is very, opioids last, interventions first, interventions fast. So the faster the primary care can get the patients to the right place, meaning pain doctors, the faster we can do things to prevent them from ever even going on that medication.
Dr. Taylor, we're so focused in terms of the opioid epidemic on those illicit drugs on the street, heroin, fentanyl, and so forth. But in your community that deals with people who have addiction problems, are you dealing with a lot of people who get problems because it starts in the doctor's office?
There's no question. I think as providers, we have to take responsibility for playing a role in the opioid epidemic and the abuse of opioids, in that we have written too many prescriptions and for too long, and maybe have not offered alternative remedies and treatments for people. So I think we have to look at that. And it sounds like both of these doctors are doing it responsibly, but there are a number of doctors who are not. And in fact, when people think about opioid addiction, they think about heroin and street drugs, but it's prescription drugs that frequently get people along that path. And it's not your typical, back alley heroin addict. We're talking about middle class, upper middle class individuals of every socioeconomic strata who potentially gets addicted. So it's a huge problem.
We are just getting warmed up. We'll have much more on the opioid prescription problem right after we check the first order. So stay with us. Welcome back. We're talking about the results of an ABC7 investigation into opioid pain medication, and a number of prescriptions doctors here on the Suncoast are writing. And joining us right now are two pain management doctors with two different points of view: Dr. Fabian Ramos of the Ramos Center, and Dr. Lindsay Job of Restore Medical Partners, and Dr. Janet Taylor of Centerstone Behavioral Health. So, Dr. Job, is there a philosophical difference between you and Dr. Ramos in terms of looking for alternatives to opioid-based pain medication first, and what techniques you use?
I actually don't think that there's a huge philosophical difference between us. I think we both are highly interventional. I've only been in the community a few years, and Dr. Ramos has a lot more patients than I do. But I think, you know, we trained in different generations, and you know, we're in a learning phase and a change phase where we're changing, you know, the way that we practice. And you know, 10 years ago, when there was a patient with a pain score of 10, you gave them pain medication. You know, and we created this monster, and now we've realized what we've done, and we're cleaning it up. And Dr. Ramos and I are both very strong interventional doctors, and that's what we need. We need these narcotics outside of the hands of doctors who don't know how to prescribe them, and get them into the pain management doctor, because we're trained to do that.
Right. Dr. Ramos, I was told that a couple of years ago there were something like 30 pain clinics in the Sarasota area. Because of the changes in terms of the county and city ordinances, it's down to like 5. But does that result in increased pressure on doctors like yourself, because all those patients that were going to those pill mills are still looking for something, and they're going to be knocking on your door and the door of other you know, physicians on the Suncoast?
Well, Alan, I am very passionate about this subject because I have been in the forefront of fighting against the opioid abuse since the early 2000s. And the answer is yes. Back in those initial 2010, around 2012, you have the data. 95% of the total prescriptions were written by specialists and doctors other than interventionalists. So only 5% of the prescriptions in the whole country were prescribed by trained pain physicians. Now what happens is that I was definitely, you know, before Dr. Job came into town, in the middle of these pill mill epidemics, I was fighting against them, working with the commissioners, working with law enforcement and the sheriff department. They used my office as the model of what to do. And what happened is that those doctors squeeze those patients, right, to answer your question, through the trained physicians. And we are decreasing and decreasing and decreasing.
Right. But let me ask you this, and the database that we have here is limited because it only covers Medicare and Medicaid patients. But in some of what you've communicated to us, you say that by far the majority of prescriptions do not come from pain specialists, but from other specialists, mainly primary care doctors as a whole. That may be true, but at least when it comes to the database we're looking at for all of Florida, if you're looking at the top prescribers, they're usually in the pain management field.
Yeah, and the answer is simple. There are only a few pain management doctors. I think that 200 or 300 practices in the whole state, and thousands of primary doctors. So the prescriptions come from the community in general, not only primary doctors, dentists, ER physicians, all doctors with good faith. It's just that what was created in the early 90s and the first years of year 2000 was a population of tolerant patients, not addictive patients, not addictive personality, not bad doctors at that time. I'm talking about the doctors without training, right, but a population that was extremely tolerant with significant amount of medications in the community.
Dr. Taylor, Centerstone deals with people who are having this problem. From what you see coming in the door, is it people having problems because they've been overprescribed by their general practitioner or these other specialists and not pain management doctors?
Well, you know, unfortunately, disparities in pain relief is still a healthcare disparity, and a lot of our patients don't have either the finances or, frankly, luck to see interventionists like they are. So if they have pain, they're going to get their pain meds wherever they can. And the reality is, any medication has the potential to be a person to develop an addiction, but in terms of opiates, because how it crosses the blood-brain barrier and the sense of pleasure and relief is so quick, those patients have a higher likelihood of getting it. So if they are, my patients who have developed addictions and certainly have become criminal justice involved are certainly abusing the medication and not paying attention to their doctor's orders, and frankly, in many cases, just don't have the same structure that these two doctors provide.
So as we all know, the state legislature is trying to deal with this, and as we reported earlier, one of the bill that's working its way through the legislature cracks down in terms of the length of any prescription, just a matter of days, 3 to 5 days, and you have to provide compelling medical evidence that longer prescriptions are necessary. Dr. Jobe, is that the answer to this problem?
I personally like the law. I think it limits people's access to long-term opioids. It limits access to excessive opioids sitting around in the house, in grandma's house, and her grandson coming and stealing them from her cabinet and she doesn't even know. There's just exposure to opioids everywhere, and that will limit some of it. And then the rest of it is that we have to continue to fight to prevent them from going on opioids to begin with. Get them to us sooner. Let us do injections. Let us use technology. We can, we've been sort of, pain management doctors are sort of treated with disrespect, and it's kind of amazing to me now that we are amazing trained doctors and we can cure your pain.
Right, but as we reported, some of the real high-tech stuff that you're doing is not approved yet by the FDA, and B, not covered by insurance,
right,
which means a lot of people simply can't afford it.
Right. 99% of what we do, Dr. Ramos and myself, is covered by Medicare and Medicaid, and it is covered by insurance. And I think that those FDA, non-FDA approved things like PRP and stem cell will be available in 2 to 3 years.
And Dr. Ramos, we only have about a minute left here, but when we're talking about the legislation being debated in Tallahassee right now, if you are limiting prescriptions, with some exceptions, to 3 to 5 days, unless you provide evidence that longer is required, is that too much in terms of your view of things?
For an acute event, I am practicing that. I am doing this on a daily basis. My patients come at the last of the rope in pain after 2 or 3 surgeries. Even in them, when I prescribe 3 days and test how the medication works on you, if they need it. If there is medical necessity supporting the use of opioids, after everything has been tried, my interventions, that, by the way, that's what I do. I spend from 6 a.m. to 3 a.m. every single day doing high-tech interventions in my office. But after that, if you are needed, I give you a 3-day prescription, a 5-day prescription, and if you need to adjust that, I give you another 3-day prescription, and then until you are managed with something that will work for you. The wrong thing will be to throw 60, 120 tablets to a patient's house, but then changing them for 120 tablets more.
Right.
That, for example, will increase just the number of prescriptions by itself.
Okay, we have to take a quick break, and we'll be back for final thoughts in a moment. Stay with us. And our guests join us right now for final thoughts. And Dr. Taylor, let me start with you. Is the situation involving opioid pain medication getting any better here on the Suncoast, or not?
Well, I mean, make no mistake, I work at Centerstone, I work at the Manatee County Jail, and maybe my view is skewed. However, like the rest of the country, opioid abuse is an epidemic. And my experience, I'm seeing it at younger ages, and also the impact in terms of disrupting families. So I think this is encouraging, but we have a ways to go.
And Dr. Jobe, we saw your practice and everything that you're doing. Are you concerned that there are other practices around here that are still overprescribing pain medication?
Absolutely, and those do exist. But I think this is a wonderful example of, 2 different generations of pain doctors coming together as one, coming together on a unified front, and fighting this epidemic interventionally and just by caring and doing the right thing for the patient. I think it's time to merge the 2 generations and fix the problem.
Dr. Ramos, if there is anything that you think that the community, the medical community and state legislators could do that they are not doing yet to limit the sheer number of prescriptions out there, what would that be?
Number one, insurances should cover abuse deterrent extended release medications at a lower cost, affordable, easy to prescribe. So the fast release. Now we have technology that if you crack or crash or it turns into paste, cannot be injected. We have technology now that if you crack, then you cannot use because it comes with Narcan and naloxone.
Right.
So there are different things that can be done, and also training of physicians.
Okay.
It's really important.
We have to leave it there. Before we go, we want to share with you your thoughts on last night's broadcast on felons voting. 1.5 million felons were stripped of their right to vote by Governor Rick Scott in 2011. Now a federal judge is ruling that's unconstitutional, and Florida residents will be getting the chance to vote on restoring voting rights this fall. It could have a profound impact on future elections in Florida. Remember, the 2000 presidential election was decided by 537 votes in Florida. So we went to Facebook for your thoughts. And Mary Louise says, I will be voting no. They lost their right when they were convicted and should not get it back. John says if they paid for their crimes, they should have their voting rights returned. And Donna says Florida is only one of a handful of states that disenfranchise and do not restore voting rights immediately after time served. The current process is a waste of tax money, creates bloated government, and unjustly denies basic rights. Well, if you'd like to join the conversation about tonight's topic, just visit our Facebook page at facebook.com/mysuncoast.com.abc7. And FYI, you can watch past discussions on demand. They're available on Apple TV, Amazon Fire, and Roku. And for the latest on local breaking news, don't forget to download the updated version of our app. If your current app doesn't work, it's expired, just go to the App Store and re-download it by searching for WWSB or My Suncoast. We want to thank all our guests for being here tonight. Dr. Fabian Ramos of the Ramos Center, Dr. Lindsay Job of Restore Medical Partners, and Dr. Janet Taylor of Centerstone Behavioral Health.